Howdy, y'all. I'm Marcia from Texas A&M Health, today's Summit Chair. As a public health researcher and practitioner, achieving health equity for all is one of my passions, and I'm assuming yours too. I'd like to welcome you to our Health Equity Innovation Summit, Part 2. We're delighted to have participants who were engaged in Part 1, as well as new participants attend this virtual summit. For those of you who want to follow the first summit, we refer you to our webpage. That's healthequityinnovation.org. You can see the agenda, the speakers, the speaker quotes, our wrap-up sessions, and the impact statement. In particular, I refer you to the background paper on an idealized clinical genomic registry led by Rick Silver, and a post-conference thought piece recently published in Frontiers in Public Health. Similarly, we'll be posting materials after this virtual summit. Our vision for today's summit is to reach an even larger audience. We will be recording this session for evergreen viewing. A major goal of this summit series is to build a network of colleagues whose research and practice is at the intersection of health equity and precision health. The primary question we're addressing today is, how can we maximize health equity in precision health? We want each of you to think about this question and make answering it a personal goal, as well as your charge to others. I'd like to highlight a few themes from our last summit, which will also be relevant to today's summit. First, we discussed the ways that precision medicine could be a barrier to reducing health disparities, or alternatively, a facilitator in promoting more equity in healthcare and health outcomes. A major takeaway point was the need to broaden our perspectives and to view precision medicine more in terms of precision health. That is, covering a full continuum, starting with what's needed to bolster prevention in diverse populations and settings. This requires the engagement of key stakeholders, patients, providers, researchers, healthcare systems, pharma and tech companies, and truly the community at large. To achieve health equity, we need a health in all approach where everyone is involved. And secondly, it's important to have a data infrastructure for addressing the many questions from prevention to treatment to recovery. Data coordination, accessibility, and sharing are key concepts for moving the field forward. Today's virtual summit is a midpoint between Part 1 and future activities which we would like you all to be engaged in. It's a time to take stock of where we are and to plan for the future. With these points in mind, we've organized the next 90 minutes to give you, first, an overview of the All of Us research program. This is the premier national initiative tying precision medicine to health equity issues. And then a review of how our summit is fitting within the broader context. And here we'll hear from our primary sponsor, Genentech, about their vision behind supporting health equity summits across the country. Then we'll have a panel that will highlight the role of tech companies and pharma and how they can be involved in providing the necessary support for looking at precision health with a health equity lens. And they'll be talking about getting and sharing data. This is such an important issue. Then we'll have our closing session where we'll review some of the major themes discussed and point toward future directions. Let me end my remarks by thanking our primary sponsor, Genentech, and our conference convener, Health Tech Austin. But we would especially like to thank all of you who are tuned in and part of this growing movement. This is what's so important for making health equity more of a reality. With our limited time today, we won't be having Q&As, but we would like to hear from you. So please let us know your name, your affiliation, what you're doing in this space, as well as any other comments you might have. If there are any questions or comments about the summit or our future plans, we encourage you to send these to Health Tech Austin, who will be routing them forward to the appropriate person. Now it's my genuine pleasure to introduce Dr. Martin Mendoza from the National Institutes of Health. He'll be providing us with a brief overview of the All of Us research program. This is truly a national treasure, transforming the way we do research in America, as well as serving as a model for other countries too. Thank you so much, and thank you again for joining our virtual summit today.